This is a presentation on microstrategy and its analysis. It's going to be presented by Rachel Day and Kiera Wagner.
The executive summary: MicroStrategy is used in 8 out of 10 major global healthcare companies. It is an EHR that can be implemented in a variety of different healthcare facilities such as nursing homes, hospitals, etc. Numerous facilities. It can be used for care management, which includes tracking data on patient care to determine what is needed to optimize care. It can also be used as a hospital quality comparison. It provides data on physician report cards. This is where patients can, I guess you could say, grade and report and number and rank the different physicians and how their services were to them. It also deals with meaningful use, in which it helps the facility that purchased the EHR know they are getting the most out of the system. It provides data and it monitors the outcomes. It shows the progress from the beginning all the way to the end of the EHR system. And the last is pay for performance. It improves safety of patients and it provides efficient systems. It measures the different submissions that are put into the data system, and it makes sure that they are accurate in the EHR system.
The business need for EHR systems is very important. It solves the problem of miscommunication of the different departments of the hospital, such as MicroStrategy uses a system where they have bracelets that have barcodes on them that the nurses will scan whenever they do a procedure or give a certain medicine. That way doctors can be informed of what's going on, and other nurses will also know not to give that person the medication that's already received it. Another business need is procedure cost forecasting. If a hospital buys a new MRI machine that can cost upwards to $1 million, $2 million a piece, there might be a need to increase the cost of a simple MRI, and being able to forecast how much will be needed to be paid by each individual is a good way to handle that. It improves doctor quality reporting and provides data for clinical research. Researchers can just simply go into the EHR and grab all the data that is in one location, so it's easier and faster for them to see trends in diseases and other things like that. And doctor quality reporting, being able to track doctors, patients, and how they're treated, and fatalities, can make sure that everyone is getting treated well and no one is being mistreated. Another business need is patient education and wellness programs. The new healthcare reform that came out in 2010, if a person is obese, then their insurance rate can be increased by 30 to 50% if they are not enrolled in a wellness program. So the EHR can help them if they have a mobile app like this EHR does, and they can keep up with their wellness program and report to their doctor daily. Also, it helps patients with their education. They can see things about their medication and even email their doctor, as well as access information online about physicians and their medication they're currently on. Risk factors for implementing a new EHR system is lack of knowledge. If the personnel that's going to be using this EHR are not up to date and well trained, then they might be scared to use it or shy of using it and not really going into the system. Also, lack of support. If the EHR company that you bought this from is not supportive and doesn't give you updates and come check on you and do learning centers for your personnel, it can be just not helpful. Also, a big problem is refusal to use by physicians. Older physicians still like using paperwork, so they don't want to use the new HR systems, and they'll just not do it, which then affects how the nurses act. And the main thing is you have to know that it's going to take a long time to implement. It's not going to take a month or 2 months. It's going to take a year, 2 years to fully implement this. And even then, it's going to need constant updates and constant learning. Also, these systems can cost $250,000 for larger hospitals, so the financial burden can be great, and if you're not prepared for that, then you won't be able to hire new staff to keep up the system, and also hire staff to input all the data.
Okay, the change assessment of management. There are different ways it can help the facility. It can improve efficiency of hospital by managing data in the hospital. It just makes sure that everything is all in one location. It helps the old data merge with the new data so that physicians and nurses can easily maneuver the data and treat and cure the patients that need to be treated and cured. It improves patient care. It helps administration with the way they schedule and how they manage the hospital's budget. It just helps the hospital know, I guess you can say, how much money the government has given them for different grants and funds. It also helps them pay their bills. It helps keep the data from the not the hospitals, the insurance companies in the computer, so that the different physicians and those in registrars can tell which type of insurance a patient has, if it's, HMO or PPO in that sense. And it can be managed by putting physicians and nurses on a board to decide which EHR will be implemented.
Having physicians and nurses on the board to pick an EHR is very important, because these are the main people who are going to be using the EHR system. So you don't want to get an EHR that is confusing for them or seems inappropriate in any way. And all personnel needs to be trained to use it. It's very important that they're all trained. And yet again, patience is key. You have to be patient with an EHR. They can't expect to be done with this in a month. They can't expect for training to only last a week. It needs to be constant, ongoing learning.
And it's also important that the hospital administrators and those over the hospital administrators can know and be trained on the EHR systems, because those under them need to feel as though it is also important to those in the higher positions. And the main key is to keep patients involved and to know that patients are the number one key in implementing the EHR system.
We chose CPSI and Next Generation as an alternate comparison. Since some of the classes that we are taking now, we have been using the CPSI system, myself and Kiera have come to realize that we don't particularly care for CPSI too much, because it's
very
slow, it's unorganized to us. It doesn't seem to flow very well. There needed to be alert functions for certain things that weren't very alertive. It would just be red. It wouldn't flash. There wouldn't be any big icon or thing that would pop up. It just seemed very, unorganized and kind of behind in technology-wise.
Yeah, it was a very older technology. It seemed as though, nothing was related to, I guess you can say, cell phones and iPhones and all that kind of stuff. There was not technology that could be sent to cell phones. Everything was just computerized. And now, of course, since technology is evolving, it's evolving into physicians using cell phones and other stuff.
Next Gen, we watched a demo on it and researched it, and it seems very convenient, because the demo we watched was of a doctor pretty much diagnosing a patient while he's at a coffee shop and the patient was at home. And he could do everything on his phone. He could send it to the pharmacy. He could
pull up her medical records.
He could see her insurance.
Allergies.
He could bill her allergies, all that stuff. Yet, I don't really know if it'd just be used for that, but it seemed very impersonal, since the doctor didn't even have to see the patient anymore.
And diagnosed her based on her symptoms.
And implementing an EHR should still be about the patient. You shouldn't spend all of your time on a computer or on your cell phone. You need to see that person, be with that person, and let them know you care. All right. The project life. To start a project, you need to have a project manager, and you need to form a team. You need to have doctors, nurses, administration on this team to find an EHR that you really like. Researching, finding an EHR that everyone approves of, making sure everyone likes it is a very important thing. The next step, planning, you need to make sure that all personnel has time to be trained on this. They need to be trained in not just a week, 2 weeks, 3 weeks even. Budget, you need to make sure you have enough money to buy this system.
Yeah, they're not cheap.
And also to hire new personnel
To teach
to
the system.
to keep up the system. You're going to need an IT person now.
And to update the system also.
Updating, things like that. Execution, just pretty much purchasing it, making sure that your vendor is going to be there to help you with updates, to give you constant training, implementing this EHR, putting it into action. It's going to take a while, but slowly putting it into action, putting maybe the emergency room in first, and then moving on to doctor's offices, and then moving on to neonatal, but slowly getting it going. Once you have it going, you need to monitor it, track data, make sure that everyone has been putting in information, not skipping sections. Maybe even ask patients if they feel like they're being neglected because of the nurses and physicians paying more attention to the computer, to them. Controlling, you need to use the data to keep up with your system, to maybe see if time is being managed wisely. Also, software updates, you're going to have to keep updating to see if there's anything that needs working on. If the doctors and nurses don't like one part of the system, maybe changing it, getting the vendor to help you out with that. The project closeout, just having everyone give a review of how they feel, making sure everyone's still happy with everything. Analysis, see how much money you've saved by implementing the system. See if you've saved money from being able to cut down on personnel, maybe on paper usage, things like that.
And meaningful use, all information is in one location. As we said earlier, it's easy to maneuver. Through patient charts, patients can find their information, put their information into their cell phones. They can tell what medication they're on, see if they have time or if they have extra refills that need to be filled in at the pharmacy. Keep up with finances. The hospital can keep up with their finances. They can keep up with the finances or the money that is due to the hospital from the patients, either from the insurance companies or from the patients themselves. Research and clinical trials, everything's in one area. They can see, what needs to be researched and what different diseases need to be, I guess you can say, cultured and done research on. And also with grants and funding, they need to, the hospitals, since everything's in one spot, they can have, I guess you can say, consistent and precise evidence that can be presented to the different government agencies, which shows them, what has been implemented with the EHR system. And I believe it was after 2000.
If a hospital or healthcare facility implements an EHR system before 2015, the government will reimburse. And I think it starts out as, if you do it in 2014, you will get 30% back in reimbursement. 2013, you'll get 50. 2012, you get 75. The longer it takes you to get it done, because in 2015, they're requiring all to have EHR systems. All right, well, this has been our presentation, and thank you for listening.
Thank you.